We will also explore new activities or policies that we can initiate together as a coalition. And in January and February specifically, we'll have the full menu of activities available for participants to review, and we'll invite you to review those ideas and express your interests to the international organizations that will be managing the various initiatives that we're going to be discussing over these 4 months, beginning tonight, or today morning for all of you. Some other administrative announcements. We noticed that there's a lot of variation in terms of screen names. So if you would be so kind to update your screen name so that it lists your name, your organization, and country, we would appreciate that. Also, we are finalizing the coalition website, and we'll be sending an email in the next few days for you to all see that website. And that will be where we will conduct a lot of our work outside of these monthly meetings. Additionally, thank you very much to many of you for your feedback on the calendar invites. We recognize we have been sending many calendar invites to participants for the meetings. So for future meetings, we're going to send only one calendar invite for the entire 4-hour block of meetings, indicating that if you are seeking to attend, the first 1.1 meeting, that's the first hour, or the 2.2, that's the 4th hour. And so we'll do the same for the public health 3-hour block, and that will cut down on the amount of email traffic, but also know that there's not an expectation that you would have to attend all of these meetings, but really those that are of greatest interest to you. And as we've said in the past, we're also seeking to increase coalition participation to include stakeholders from different agencies in your countries that relate to synthetic drugs. For example, chemists, policymakers, justice system representatives. So please continue to share the coalition registration links with your colleagues so we can make sure that all the stakeholders have a seat at the table. I will ask also Sarah from INL to paste the agenda so that we will have today's agenda available in the chat for everyone to see. Now, I will turn it over to the co-chairs for today's meetings to call on presenters, share thoughts, and moderate the discussions. And we've got Henning Root from South Africa and Andrew Cunningham from EMCDDA. Thank you both for being here. Please take it away.
Thank you very much, Browne, and thank you for this opportunity. Welcome to everybody. Welcome to the second meeting of the Sub Working Group 1.1. My name is Henning Root. I'm from South Africa. I'm the National Chemical Monitoring Coordinator, and I'm attached to the South African Police. Today it's a privilege for me to welcome Andrew Cunningham as part of this meeting. Andrew will assist in chairing this meeting, and I'm going to throw it over to Andrew. Andrew, thank you so much.
Thank you, Henning. Thank you to the organisers, and thank you for inviting the EMCDDA to be involved in the Global Coalition. When the European Commissioner for Home Affairs, Ylva Johansson, was present for the launch of the Global Coalition, she said that the coalition could count on the support of the European Union, and that's one of the reasons why I'm here today, and I hope I'm useful in this process. We don't have that much time. The chairs are going to be quite brutal with the speakers because of our limited time, and session 1.1 will start directly after this one. So we need to make sure we finish on time, and we want to leave space for contributions and discussions at the end. So I'd like to make sure that the speakers keep to their allotted times that have been already indicated to them before we started. Okay, so let's not mess about and let's get straight into the first presentation, please. I'd like to introduce Conor Crean. Conor is a Scientific Affairs Officer working in the Laboratory and Scientific Service of the UNODC. I'm sure many of you will know Conor already. He's going to talk to us today about tools and resources that are available at the UNODC to assist member states in understanding the manufacture of synthetic drugs. Conor, you have the floor.
Thank you, Andrew. Good afternoon, everybody. I'll just my screen. So I'd like to talk to you a little bit today, as Andrew mentioned, about the tools and resources that we have within Laboratory and Scientific Service of UNODC to assist member states in understanding and responding to manufacturing of synthetic drugs. I'll talk a little bit about different products and manuals and guidelines that we have that are all connected to different types of training courses that we can carry out within the laboratory for assisting frontline officers, customs, border personnel, and forensic personnel in the identification of synthetic drugs. If we want to think about why this is a big issue for UNODC in the last number of years, it's because there has been an increase in the number of substances that have been placed under international control. So if you look at this slide, you can see that within the last 8 years, almost 80 substances have been included in the 1961 and 1971 conventions. And in addition, 10 precursor chemicals, so 5 precursor chemicals for fentanyl and analogs, and 5 precursor chemicals for amphetamine type stimulants have been placed under international control. So regard to the work of UNODC, we have to respond to the emergence of substances, their prioritization for scheduling, and also assist member states to be able to implement scheduling decisions. And one of the important parts of this is understanding how synthetic drugs are manufactured. So I'll start off showing you some of the resources that we have. And the first of these is a very comprehensive manual we have on the clandestine manufacture of substances under international control. So this document is over 400 pages and it has 2 addenda. So this resource is quite comprehensive and provides a lot of information on different elements that is necessary to understand when it comes to synthetic drug manufacture. Firstly, there are monographs of the substances most commonly manufactured in clandestine laboratories. And this consists of a lot of information about the substance, its control status, and the precursor chemicals that can be used for its manufacture. In addition, there are several sets of cross-referenceable tables which can be searched to provide more information about if a substance has been identified, what precursor chemicals can be used for its manufacture. And we find this very useful for those investigating clandestine laboratories. So if they find a chemical or a reagent that has been identified in a laboratory, this gives some indication of what drugs that it can be used to manufacture, and assists in the response and how the investigation should then be carried out. As I said, because of the increasing number of scheduling decisions in the last 8 years, we have produced 2 addenda for this document, and we're also incorporating all of the aspects of this resource, which is currently law enforcement sensitive document, into the UNODC early warning advisory. So this will enable law enforcement officers on location to be able to search for these resources and linked tools that will assist them in the work that they do. Related to the area of manufacture of synthetic drugs, we have a number of manuals and guidelines related to the safe handling and disposal of chemicals. So we have 3 manuals in this series, and we are also producing another manual on the dismantling of clandestine laboratories. So for each of these for which we have training courses, we will also be developing further training courses to be provided in the laboratory here in Vienna or also in the field. And I'll talk about some of these in one of the other working groups as well. Another resource that we have available, which is something that UNODC does after scheduling decisions, is to update the multilingual dictionaries of substances under international control and precursor chemicals used for their manufacture. So each year there is in the last 8 years, an addendum has been produced regarding each of the 78 substances, containing information on each of the 78 substances and 10 precursors that have been scheduled. So this is available in all 6 official UN languages and assists member states with fulfilling their obligations in implementing international scheduling decisions. I'll just mention 2 final resources that we have. The first of these is a project that we have started a number of years ago just last year actually, in Latin America, and we're also doing it in Southeast Asia. And this is to assist member states in the development of national interagency disposal plans. So to help bring the different stakeholders together nationally and provide them with solutions, training, and advice for the handling and disposal of drugs and precursor chemicals used in their manufacture. One final resource I'll mention in this presentation is the UNODC Early Warning Advisory. This contains a wealth of information regarding synthetic drugs, new psychoactive substances. We're monitoring over 1,200 substances at the moment. Law enforcement, forensic personnel, policymakers can each have access to different aspects of the system to search for resources that would assist them in understanding more about synthetic drugs. In particular, I'd mention national legislative responses. So law enforcement and forensic personnel need to be more involved in the development of national legislation, and this information contained within this aspect of the early warning advisory can assist in responding to emerging synthetic drug threats and assist in developing appropriate responses at the national level. There are a lot of dashboards and analytical tools within the system that I would invite all participants to make full use of. And with that, let me thank you for your attention, and hopefully didn't speak too fast. Thank you.
Thank you very much, Conor. It's clear that the UNODC have really been working quite actively in this area, developing the toolkit on synthetic drugs over the last number of years, and quite a lot of resources are already very well developed on this. Thank you also for keeping to the time. Hopefully that means we'll have time for discussion near the end. So I believe we have a few minutes for country intervention at this point. I'll pass the floor back to Henning, and we are going to move through the formal presentations and keep the discussion for the end. I hope that's okay for everyone. We want to manage the time as best we can. So Henning, over to you.
Thank you very much, Andrew, and thank you. I was going to, not to waste any further time, I would like to introduce our second speaker. It is Ling Wong from the UNODC. Over to you, Ling.
Good morning, good afternoon, and good evening to you all. Thank you for inviting me to speak in this very important meeting. My name is Ling Wong, and I'm working together with Conor in the Laboratory and Scientific Services. Now, today I would like to give you a brief introduction into the tools and services UNODC provides to build forensic laboratory capacity in member states to analyze and identify drugs and precursors and profiling. I would like to mention that through the UNODC International Quality Assurance Program, the Laboratory and Scientific Services aims to improve national forensic capacity and capabilities of member states to meet internationally accepted standards and ensure that they are available and accessible worldwide. Now, to this end, we provide manuals and guidelines on quality assurance and recommended methods of analysis of drugs. We also implement the proficiency testing scheme called the International Collaborative Exercises, or ICE in short, to enhance capacity to identify drugs and new psychoactive substances using recommended guidelines. In addition, we also provide reference material of drugs as well as tailored training and mentoring support to our partner laboratories. As many of you already know, UNODC publishes a series of manuals and guidelines since 1984 to enhance the operational capacity of drug testing laboratories, to improve the quality of their performance, and to promote standardization of working practices on many topics traditionally on drug identification, but has recently expanded to include chemical disposal, crime scene investigation, quality assurance, and security document examination. Here are some examples of manuals covering topics on quality management. And a vast majority of the series covers recommended methods on the analysis of drugs in seized materials and biological specimens. We have also dedicated manuals on the analysis of new psychoactive substances and profiling of drugs, heroin and cocaine in particular, which is currently being revised and will be published very soon. Next, allow me to give a brief introduction to the UNODC International Collaborative Exercises Program, or known as ICE in short, which is an important part of the UNODC International Quality Assurance Program. And this program aims to assist forensic laboratories both from developing and developed countries to continuously monitor their performance on a global scale. This diagram gives us a good overview of the ICE program. Participating laboratories are provided with test samples, which mimic the actual casework samples, and laboratories are required to analyze them. Upon submission of results, immediate and confidential evaluation is provided. I would like to stress that we treat the results confidentially to establish trust with laboratories so that they can improve their performance without fear of being penalized. We also provide feedback and mentoring to laboratories who need more assistance. The main benefits of the ICE program are obtained through continuous participation. Laboratories can continuously self-assess their performance, identify weaknesses, and improve their processes. The program is still currently free of charge, not just for the test samples, but also for the provision of reference material, which occurs once every 2 years. Since the program started in 1995, we have more than 460 laboratories participating from 110 countries. As mentioned before, we provide reference material once every 2 years. This year is the year we normally conduct this huge exercise, and so far we have sent over 5,000 units. The ICE program covers the main group of drugs and selected new psychoactive substances in seized material and biological specimens group as set by a panel of forensic experts. Reference materials would be provided according to this menu of substances. There are altogether 2 rounds per year with 4 test samples each. The laboratories have the flexibility to use a range of analytical techniques available to obtain the results. Qualitative analysis is compulsory, however, quantitative analysis is voluntary but highly recommended. After submission of results through an online platform, laboratories will receive a confidential evaluation report immediately. And at the end of the round, a summary report on the overall performance of laboratory will be provided. Through these exercises, laboratory can continuously evaluate their performance and assess the quality of their results on a global level. With regards to training, UNODC provides training to law enforcement officers and forensic personnel on a variety of topics such as drug identification and testing, crime scene awareness and investigation, and security document examinations. These training sessions are conducted here in the UNODC laboratory in Vienna, Austria, as well as on-site in the field. We also provide short courses virtually, a skill we mastered through the pandemic days. If you have any queries, please feel free to write to us at UNODC-ICE for anything related to the ICE program, and for all other queries, kindly write to UNODC-Lab. Thank you for your attention.
Thank you very much, Ling. Thank you for that nice presentation. The UNODC is definitely a great asset in the combat and the fight against crime. I know as an investigator myself over the years, you have made mention of manuals and guidelines that's available. Now, as an investigator myself, I can concur that I have definitely made use of those manuals and those guidelines that definitely assisted me in executing of my duties. So from my side, from South Africa side, and I think I'm speaking on behalf of everybody, thank you for the great service and that the UNODC is giving us, giving to the world. And I'm looking forward to seeing, to basically, you were talking about the training that's available. I'm looking forward to go look into that as well. And thank you so much. I really appreciate the time. Thank you so much. Andrew, I'm going to pass over to you again, but thank you very much, Ling. Appreciate it. Over to you, Andrew.
Thank you, Henning, and thank you, Ling, for the presentation. I think I certainly have got a few questions after your presentation about precursors and the ICE program, etc. And hopefully we'll be able to have a bit of space for some discussion of that after the next presentation. So I think we are doing quite well for time. The speakers have been very disciplined today, which is nice. So the last speaker that we have is Thom Browne. Thom is the Chief Executive Officer at the Colombo Plan Secretariat, and Thom's going to speak to us about the Colombo Plan's toxic adulterant program. And I'm sure everyone here will be quite interested in what you have to say, Thom. The floor is yours.
Okay, can you hear me? Well, okay, I'll hit share screen. And let's see, This is it. And okay, yes, yeah. Back in 2010, Colombo Plan started a program testing street drugs worldwide because the composition of street drugs we found out had been changing. When I worked at DEA in 1982, I worked on the first fentanyl or synthetic drug epidemic in the U.S. Back then, whether it was fentanyl, synthetics, or legacy drugs like heroin or cocaine, they were cut 1 or 2 times. If we fast forward to today, we're finding in the U.S. and around the world, it's a more complicated situation where many drugs can be cut up to 20, 21 times. And this makes it difficult to separate these mixtures. When you're analyzing the drugs, it's important to identify every compound in an individual drug sample so you'd have an idea of what's causing overdose or what's causing chronic health problems. And today, based on the analysis that we do this worldwide. We found out in the US about 32% of the street samples we analyzed are cut anywhere from 15 to 21 times. And it's a very complex mixture of multiple fentanyl and fentanyl derivatives, legacy drugs, heroin, cocaine. You also have synthetic cathinones, cannabinoids, and synthetic hallucinogenics in the actual same drug sample. So it's very important to be able to, when you conduct an analysis of these drugs, to conduct analysis of everything that is in that sample called a mixture, so you know what's causing overdose and what's causing health problems on that. And we first started going overseas. We were called down to Brazil and Argentina, where we had people were getting sick from cocaine. But it just wasn't the cocaine. If you conducted a full-scale analysis of everything in that drug sample, it found out there were a bunch of cutting agents, banned pharmaceutical drugs or veterinary drugs that were causing a series of health problems. For instance, street kids in Sao Paulo were 8, 9, 10, 12 years old, were experiencing kidney damage, which is very rare and unusual for a kid 12 years old. When analyzing the crack cocaine they were smoking, found out the adulterant, or the banned analgesic drug phenacetin, was in there. Phenacetin was banned because it causes kidney damage, it depletes red blood cells. And when it was in aspirin in humans in the 1960s, it caused kidney damage over time. But when you had a street kid or someone smoking crack 30 times a day, 7 days a week for months on a time, within a matter of months, they're going to develop kidney damage. So by doing that full-scale analysis, analyzing every drug sample, we're able to tell what was causing kidney damage among street kids in Sao Paulo, Brazil. Likewise, a lot of drug users were getting all sorts of bizarre infections and diseases. The reason was their drugs were also cut with unique adulterants at the time: levamisole, a veterinary dewormer, mebendazole, a banned analgesic, and aspirin, the same with aminopyrin, a banned analgesic, banned because they deplete white blood cells. This explained the bizarre infections and diseases that were actually seen. In Ecuador, there was overdose from opioids, but it wasn't fentanyl. They had a brand of heroin called H, and when we went down here to analyze it, the thing that was causing the problems, with the compound causing the problems, was the high blood medication diltiazem. Diltiazem, when combined with heroin or opioids, has a synergistic effect, almost a double depressant effect, that was causing overdose not only in Guayaquil, Ecuador, but in the Northeast United States where it was shipped. And in addition, by analyzing everything in the drug sample, we found out that cocaine was in there too, causing a speedball effect. So it was very necessary to analyze all compounds in the drug sample to understand what causes health problems or what causes overdose and lethality. Also, by doing the full-scale analysis of what's in the street drug sample, we got called to Chicago, Illinois, because in the state of Illinois, the drug users during COVID in Chicago had an unusual high rate of COVID among substance users in Chicago, but not the rest of the state. By analyzing hundreds of samples, street samples of drugs in the state, we found out that Chicago was unique. There were a number of cutting agents highlighted in yellow that are known to deplete white blood cells. And this did not appear in the rest of the state. And this explained why substance users were suspect to high rates of COVID during the COVID epidemic, because their immune systems were being compromised with white blood cell depletion. In the same way, a lot of our first responders were experiencing problems with administering naloxone. Instead of taking 1 or 2 doses, there were instances where emergency technicians had to administer 5, 6, or 8 doses of naloxone. And it was not an understanding why. But by analyzing all compounds in a street drug sample, we found out that half of the, say, constituents in the drug sample, the sample was cut 20 times, 7 or 8 of them, those compounds were known to actually affect naloxone administration, requiring more naloxone. So the reason we're able to answer the questions of don't panic because naloxone works, but it's going to take longer because the street drug sample may contain 10 compounds. 5 or 6 of those are known to affect naloxone administration, so it's going to take time. So by doing the full-scale analysis, we're able to determine what was affecting naloxone administration. The same thing applies, not just seized street drugs. We also analyze overdose fluid samples. And we've seen the same thing with the street drugs, where it could be up to 15, 20 compounds in the street drugs. When you analyze the overdose serum of a person who overdosed on drugs, you find the same thing. Multiple legacy drugs, methamphetamine, cocaine, amphetamines, fentanyls, multiple fentanyl compounds, isotoniazine, synthetic opioid. And so we find the same pattern happening. And so part of the program we have, which we call the Sentinel program, it's one thing to analyze what's on the streets in the United States or any other country. So you see drugs are cut 20 times. That's not how it comes in the country. So it's important to look at the borders, how the drug is coming into a country. And we did this with the United States as it come from Mexico into the US. We found out there's maybe 3, 4, 5 compounds, say, in a fentanyl pill sample. The importance of doing the full-scale analysis and identifying everything, it's accepted that fentanyl is lethal at 2 milligrams. However, these samples are not 2 milligrams, they're 1 milligram or less. But why would this be lethal? Why would it cause overdose? It's because the compounds highlighted in yellow are known to potentiate opioids like heroin and fentanyl, making them more potent. So a 1 milligram fentanyl sample, say, that's cut with metamizole, levamisole, xylazine, and limited amounts of parafourfentanyl is more lethal than a 2 milligram dose. So this redefines what is lethality, what's a lethal dose. So that's why it's very important to analyze every compound in the actual drug sample to find out, even though this fentanyl pill is under 1 milligram, it is still highly lethal, because these adulterants or cutting agents in there basically will actually potentiate that and make fentanyl more lethal. So what we've done with a lot of countries will have GC/MS machines to add equipment to analyze drugs. However, if you have a complex mixture of 15, 10, 21 compounds in a drug sample, GCMS is not likely to separate all those. So it's important to use a technique that could, an analysis technique in a machine that can identify and separate all compounds in a drug mixture and also do the quantification on that so you can determine potency, lethality enough. So what we do, we train on LC-MS machines and LC-MS technology. Because these machines will detect everything in a complex mixture in a drug sample. So, and also will quantify. So you'll have a better idea of what's causing overdose and severe health problems. When we conducted training in the United States, we conducted at a lab with NMS Labs in Willow Grove, Pennsylvania. One unique aspect that they have hundreds of street samples from the United States, have complex mixtures that have caused overdose. We divide them into samples that cause fatal overdose like these, or samples that cause non-fatal overdose. We have them in wholesale, retail quantities. We have them in kilo bricks, liquids. We have them in powders, in pills. So basically anything that, say, caused an overdose worldwide, we have all those different mixtures of drugs, that actual samples that can be tested on, and not only seized drug samples, but the overdose fluids. We have hundreds of overdose fluids that cause overdose. So we can train people on both identifying everything in an overdose fluid and everything in a seized drug sample to better identify what caused overdose death and what's causing severe health problems. And in that we had, we had trained in the United States, report Jordan, to basically develop techniques to find out everything that's in a Captagon sample. We've trained Brazil, South Korea, United Kingdom, Philippines, in the US. We've gone overseas and, trained in Guatemala, Honduras, Argentina, Brazil, Sri Lanka, South Africa, on how to detect everything in a seized drug sample or overdose fluid. So you can have a better idea of what's driving overdose and causing health problems in the country. And what we also do is to help get the word out. We also help the countries develop public health alerts based on what's found. For the adulterants, unique adulterants like phenacetin that causes kidney failure, or levamisole that depletes white blood cells, when we do the public health alerts, we have a panel of medical doctors that develops what we call a medical flow diagram that lets treatment and public health professionals know how to diagnose exposure to an adulterant like phenacetin and how to treat it. And also with the seized drug samples, what we'll do, if it's something new, like a new synthetic opioid, like a nitazene, isotonidazine, in the alert, we will put in there ways that you can detect it in both seized drug samples and overdose fluid. But the key that we found out is because the pattern of drugs has changed worldwide, especially the actual cutting of drugs, where we can see up to 15 to 20 compounds in a sample. It's necessary to use an LC-MS analysis to test for all of this. Thank you.